Hello, good morning. Today's session, the unit we'll be doing is 4.17, Health and Social Care in Context, Unit F5037164, and my name is Shazia Khan. Today we'll be looking at Learning Outcome 1, which is to understand the structural organisation of a chosen health and social care area. So the unit aim is to develop an understanding of a health and social care area in which students would like to work. You will develop your understanding in order to critically evaluate the impact of legislative frameworks in the context of local practice. 1.1 is to analyse organisational structures within the chosen area. You will need to choose a specific area of health and social care, for example, the care of children or young people, or the care of elderly. So it could be anything. You could look at a specific area. So it could be working with people with dementia, or working with people with cancer, anything like that, or working with young children. So 1.1 is to analyse organisational structures within the chosen area. So organisational structures include private and public funded provision. What is private funded care? This is where an individual would pay for healthcare insurance policy privately, or their employer will offer private medical insurance as part of their employment package. So you've got organisations such as Sovereign, Bupa, and that will be part of your employment, your wage, your employment programme. So publicly funded healthcare is paid by the government through the collection of national insurance and taxes. Charities will also contribute towards this. Collectively, these charities 1 million every day. 1.1, analyze the analyze the organisational structures within the chosen area. Examples of private and public funded provision include individual organisations such as hospitals. These are a healthcare institution providing patients treatment with specialised medical and nursing staff and medical equipment. The best known type of hospital is the general hospital, which is typically an emergency department to treat urgent health problems ranging from fire and accident victims to a sudden illness. They have a department called the A&E, which everyone comes into the emergency department, and if there's any sort of issues, they will be resolved there. 1.1 excuse me. 1.1 is to analyse organisational structures within the chosen area. So care homes. A care home in the UK is usually a communal residential centre where staff can provide the residents with personal care they need on a daily basis, such as helping them dress, wash and use the bathroom. Some care homes also offer nursing care and medically trained staff to help those with greater needs. So it'll be things like, for example, you know, elderly patients that go to live in the care home and their families cannot provide anything at home due to the fact that they may be working. And also it's if they're living on their own and they need any sort of facilities for any sort of residential care of an older person, they provide the care homes provide accommodation and personal care with extra support for people, maybe people with dementia or Alzheimer's, or anyone who's got, you know, got any sort of other medical problems. Personal care is what they would do on a daily basis. So as we've stated, they'd help them with washing, dressing, using the bathroom, eating if they can't eat, or taking medication. And also in some care homes, they do offer the element of social activities or trips or outings. Then we've got home care organisations. These type of care homes is known as a home care or domiciliary care. And or sometimes home help. Help at home from a paid carer consists about around £20 an hour, but it varies according to where you live. Sometimes a council will contribute the cost. Home care is very flexible. You need a paid carer for only an hour a week or for several hours a day. So, you know, there's lots of services out there that provide that, private services that provide home care to patients. And it's the care that they need in their own home. This might be someone who's a carer who lives with you, living carer, or someone who visits you on a regular basis, or someone who provides like specialist care for you in the UK as well. So, you know, these kind of services, they are available for anyone. 1.1 is to analyse organisational structures within the chosen area, and we're looking at daycare centres, and this is for children, also called daycare centres, nursery school or creches, an institution that provides supervision and care of infants and young children during the daytime, particularly so that the parents can hold jobs and go out to work. And some places actually do after school daycare as well. So if the parents are running a little bit late after work, they can put them in that daycare as well. A daycare centre and unit for the elderly is a centre-based community care services, providing daytime care, rehabilitation exercises and social activities to the frail elderly persons aged 60 or above. They are assessed and recommended for community care services or residential care services under the standardised care need assessment mechanism for elderly services, including those suffering from dementia. 1.1 is to analyse organisational structures within the chosen area. So we've got groups like Healthcare Trust in the UK, which is Hospital Trust, also known as Acute Trust, which provides secondary care services, Mental Health Trust, Ambulance Service Trust, and Community Health Trust. Then we've got groups like Private Care Groups, Bupa, and then we've got AXA, and groups like HCA, Virgin Care and Circle have also been working in partnership with the NHS Trust across the country. These groups, like the NHS, provide high quality treatment within state-of-the-art facilities, supported by the latest technology and the infrastructure of large NHS hospitals. 1.1. To analyse organisational structures within the chosen area, charitable organisations such as Barnardo's. Barnardo's is a British charity funded by Thomas John Barnardo in 1866 to care for vulnerable children. As of 2013, it raised and spent around 200 million each year, running around 900 local services aimed at helping these same groups. And then there's Help the Age, which is Age UK, is a registered charity in the UK, formed on 25th of February 2009 and launched on 1st of April 2009, which combined the operations of the previously separate charities, Age Concern England and Help the Age, to form the UK's largest charity for the older people. UNICEF works in over 190 countries and territories to save children's lives, to defend their rights and to help them fulfill their potential from early childhood through adolescence. 1.2. Evaluate the roles and responsibilities of agencies external to the area who advise and influence it. There are many agencies that advise and influence services. Agencies such as government departments, for example, the Department of Health in the UK, health and social care organisations, for example, NHS, Healthcare Trust, etc. Regulatory bodies such as health protection agencies, and then professional bodies such as the Royal College of Nursing, guidance bodies, example, National Institute of Clinical excellence, and then the international bodies, for example, the World Health Organization, and charities, for example, Multiple Sclerosis Society, UNICEF, or Barnardo's. 1.2, evaluate the roles and responsibilities of agencies external to the area who advise and influence it. Government departments, example, Department of Health in UK, the Department of Health and Social Care is the UK's government department responsible for government policy on health and adult social care matters in England. It oversees the English National Health Service. The department is led by the Secretary of State for Health and Social Care, with 3 Ministers of State and 3 Parliamentary Under-Secretaries of the State. 1.2, evaluate the roles and responsibilities of agencies external to the area who advise and influence it. Health and social care organisations, for example, such as the NHS, healthcare trusts. NHS Trust was established from the National Health Service and Community Care Act 1990 and was set up in 5 waves. Each one has established by statutory instrument. Each trust is headed by a board consisting of executive and non-executive directors and is chaired by a non-executive director. There are about 2,200 non-executive across 470 organisations in the NHS in the UK in 2015. Non-executive directors are recruited by open advertisement. All trusts, foundation trusts and those which have yet to be reach foundation trust status are regulated by NHS Improvement. Board members are subject to a fit and proper person test. 1.2, evaluate the roles and responsibility of agencies external to the area who advise and influence it. Regulatory bodies, example, Health Protection Agency. This includes the Care Quality Commission in England and the Regulation and Quality Improvement Agency in Northern Ireland. Other regulatory bodies in the UK assess the quality and safety of medicines and medical devices used in the healthcare sector. An example being the Medicines and Healthcare Products Regulatory Agency. Regulatory bodies include the General Medical Council, which regulates doctors, the Nursing and Midwifery Council, which regulates nurses and midwives, and the Social Work England, regulated social care workers in England. 1.2, evaluate the roles and responsibility of agencies external to the area who advise and influence it. The professional bodies example is the Royal College of Nursing. The Royal College of Nursing has a clear view that all healthcare support workers should be regulated in the interests of public protection and patient safety. So if, you know, anyone that becomes a nurse or anyone that needs to be regulated would have to be regulated by a professional body. And for nurses, it's the Royal College of Nursing. And it's really important that everyone is registered under that. They actually are there to represent the professional interests of the nursing staff working in the public, private and voluntary sectors. And they are on the NHS Staff Council, which negotiates pay, terms and conditions for NHS staff, and also bargain for pay and term and conditions. The Royal College of Nursing believes that health and social care support workers who deliver direct clinical care alongside registered nursing in the nursing team should be regulated by the nursing regulatory body, the NMC. Also, the Royal College of Nursing is committed to lifelong learning and the development of other members. So they're there anything to do with your placement or anything to do with your first nursing role, and they're there to support you and guide you. The majority of members are registered nurses. However, student nurses and healthcare assistants are also members. 1.2, evaluate the roles and responsibilities of agencies external to the area who advise and influence it. For example, guidance bodies are the National Institute for Clinic Excellence. The National Institute for Clinical Excellence was established on 1st of April 1999 as a special health authority by order of the Secretary of State to promote clinical excellence in the health service. It aimed to support the reduction and variation of the availability and quality of the NHS treatments and care nationally. It also provides guidance and advice to improve any sort of health and social care settings. In the UK, the National Institute for Clinical Excellence is part of the UK NHS. It provides guidance, as stated, for the NHS and patients and their carers, and that aims to inform decisions about any sort of treatments and any sort of developments in the NHS. 1.2. Evaluate the roles and responsibilities of agencies, again to the external, to the area who advise and influence it. And the one we've got in there, the next one is the international bodies also influence that, and it's things like the World Health Organization. And the World Health Organization is WHO, is a specialized agency of United Nations that is concerned with international public health. It was established on 7th of April 1948, and its headquarters are in Geneva, Switzerland. The World Health Organization is a member of the United Nations Development Group. The World Health Organization Constitution states its main objective as the attainment for all the peoples of the highest possible level of health. It has headquarters in Geneva, as mentioned earlier, 6 regional offices and 150 field offices worldwide. It's there mainly to promote health, keep the world safe and serve the vulnerable. Their goal is to ensure 1 billion more people have universal health coverage, to protect 1 billion more people from health emergency, and provide a further 1 billion people with better health and well-being. They are there really to support the people and try to identify any sort of public health issues and deal with them. So 1.2, which is to evaluate the roles and influence and responsibilities of external agencies who advise and influence them. The NHS charities, Multiple Sclerosis Society, UNICEF, and Barnardo's. So there are more than 250 NHS charities across the UK, and the most of them focus on helping hospitals. Our hospitals do more. Collectively, these charities give 1 million every day to the NHS. 1 million every day to the NHS, so that people can stay well for longer and get better faster. In recent years, the NHS charities have funded major capital projects, pioneering research and medical equipment at our hospitals, helping patients access the best possible care when they need it. They also play a key role in mobilising volunteers to support NHS staff brightening wards and waiting areas with colourful and engaging art, and building an important link between hospitals and our communities. Other NHS charities support mental health issues, community health trusts and ambulance services. We've got some examples on the side in regards to the different NHS charities, and the largest one is in the UK is the Charity for People Affected by Multiple Sclerosis, and it's based in London, and it's there to support people and work together to cure multiple sclerosis for every single person as fast as possible. And multiple sclerosis is a disease that impacts the brain, spinal cord and optic nerve. So they are there, and it's one of the UK charities to help support people with that. Another one, as we mentioned earlier, was the popular one, Bernardo's, and then we have the other one was UNICEF, which is trying to make the belief that they try to make the world a better place for children, and trying to change children's life and raise funds to help save lives of children, and ensure that children are kept safe. So these kind of charities, and there's a lot more charities available outside that support different kind of causes for the elderly. They have Dementia UK, they have Age UK. So these kind of charities will help that specialist kind of area. 1.3, analyze individual functions and roles within organizations in that area. There are many individual roles and functions within an organization. We will be looking at the internal structure of our organization, functions of an organization, roles within an organization. So 1.3, analyze individual factors and roles within organizations in the area. So internal structure is the hierarchy of governance and the management of healthcare firm. This hierarchy is a list of systematic arrangement of all healthcare management professionals that work all together to handle the administrative department of any healthcare firm. So we've got the healthcare management hierarchy, and we've got the dean of the hospital, we've got the hospital administration, the head of surgeons and doctors department, the head of nursing department. Under the hierarchy, we've got head of emergency department. Then under them, we've got the head of recruitment department, the head of medicine department, the head of equipment department, the head of security department, medical students administration and inventory head. So this is the healthcare management hierarchy. 1.3, analyze individual functions and roles within the organizations in the area. So we've got the dean of the hospital. They manage the operations of the entire healthcare firm while enjoying the maximum authority and the power in the same. Hospital administrators, they take care of various departments of the healthcare firm involving any financial issues, any daily operations, any events, funds, in order to ensure the smooth administration of the workplace. Then we've got the head of surgeons and doctors department. They manage surgeons and doctors and perform all administrative duties. The head of nursing department manages the team of the nurses in a healthcare firm. And then the head of recruitment department, which is the head of medicine. We've got head of medicine department. Then we've got the head of emergency department, which manages the emergency department staff, schedules and duties. Head of equipment department, which deal with all the equipment within the NHS. The head of the security department, which will be dealing with all the security within the hospital or any issues they've got with security. And then we've got medical students administration, they are responsible for the students who enter the healthcare industry as an intern to gain practical knowledge and experience. And then we've got the inventory head. These are professionals responsible for maintaining the supply of goods to the hospital while ensuring appropriate stock is always there to handle any emergency. 1.3, analyze individual functions and roles within organizations in the area. So the functions within an organization, the administration, this is the process of running a business, managing daily tasks, staffing and schedule and ordering of supplies. Finance is the management of large amounts of money, especially for governments or large companies. Payroll, it could be salaries, it could be anything to do with expenses or anything that they have to spend out. So this department deals with the whole finances for the NHS. The delivery is managing service delivery, so equipment that's coming in, medicines that are coming in, being delivered, any sort of services that are being delivered, deals with all the service delivery. Human resource management provide HR services to staff. Human resource management will deal with everything such as any sort of wage issues, any sort if you want to get your P60 or if you've got anything on your contract of employment, these will deal with all that. Then you've got recruitment and selection, and this is where they will hire people, and also in regards to they will go through the selection process and recruit people on the basis that there's a need for maybe extra nurses or extra doctors or student nurses, healthcare professionals. So the recruitment and selection, this is where the hiring will start. Then we've got the skills and monitoring and training. So this area is quite important for a lot of the departments, for doctors, nurses, healthcare professionals, anyone within the NHS would need some sort of training and skills, things like you could have training on safeguarding, which is really important at the moment in regards to bringing children in, the safeguarding of children, what procedure you must follow if someone comes in, and if there's been any issues of safeguarding, issues of domestic violence. So they could do training on areas that may be predominantly quite popular, that people come in. Counselling, training on counselling, training also things like if it's admin workers or anyone else, manual handling, how to pick up boxes and the safety side of it in regards to that. So these kind of training, all the professions, most of the professions within the NHS would need skills monitoring and training. Then we've got 1.3, analyze individual functions and roles within the organisation. Some roles within the organisation, managers will be there obviously to manage, administrators would be there to administer what's going on, deal with the responsibilities of any sort of office work, anything like that. Doctors obviously are there to perform their duty as a doctor and look after the patient, nurses to support the doctors and look after the patients, care workers if there's elderly patients or anyone that needs any sort of care, these are additional support. Maintenance staff will be people that deal with the equipment, but also any sort of faults that occur within the NHS, they will be the ones to maintain them. Things like, if there's any issues in regards to trolleys, wheelchairs, things like that, they will be the ones to deal with. Any lighting issues, the maintenance staff, there is a need for maintenance staff within the NHS. And then you've got pharmacists within the NHS. They would have pharmacists, which is really, really important to have pharmacists, because if people come into the hospital and they are, they have to stay in the hospital, they will need medication. So the pharmacist will deal with all the medication for each ward or each department and then allocate that medicine to that department. So there's a huge need for pharmacists in there. So today we've looked at the different organisational structures of a chosen area. We've looked at the role and responsibilities of external agency who advise and influence it in regards to things like the UNICEF. We've looked at the National Institute for Clinical Excellence. We've looked at the issue in regards to the World Health Organization and the importance of that. We've also looked at things like the different types of charities that are that provide things like Multiple Sclerosis Society, UNICEF, Barnardo's, the importance of these, why there's a need to have these charities. And sometimes, people set them up because it's a personal thing to them. So these charities are there to, help individuals, maybe children, maybe elderly. Then we looked at the individual functions and roles within organizations. So different roles like managers, nurses' roles, the administrator's role, the doctor's role, the care worker's role, and the importance of these roles, and also the different functions within an organization. So things like the recruitment and selection, the human resource management department, the finance department, these work hand in hand for any organization, but for a large organization such as the NHS, there is a need to have these different departments within the organization, and there's also a need to have different roles within the organization so that people know who deals with what, because sometimes if you are unsure what you deal with, then it could all just go wrong. So it's better to have the finance separate than the administrator separate, the maintenance separate, the department, the human resource department separate, that deals with all the finance side for employers, and then training part of it separate, which is quite an important part, as I mentioned earlier, in regards to people being trained whilst they're on the job, or this extra training they'll need. Things like if there's a big influx of people that need safeguarding issues, that would be a big area that would be dealt with, or anything to do with issues of domestic violence, or anything to do with manual handling. So these kind of training needs to be given to a lot of the people within the NHS sector. So some of the references that are here, which you could refer to when looking at some additional reading, but also refer to Moodle for additional sources, because Moodle will have a lot of additional sources for you to read, any sort of additional work that you need to do. And these are some of the sources that we've used today, which is the hierarchy of healthcare business management, and the link is there. You could actually link on that and it would go straight to it, and it's the hierarchystructure.com. And then the enclosure F, which was a healthcare governance arrangement policy. It's a PDF document, and it would, I'll link on that for you, and it would take you straight to the NHS, and it would look at the healthcare governance arrangement policy and the framework of the NHS. So it's quite a lengthy document, 42 pages, and you could read that and identify some issues from that in regards to the NHS. So these are the references that we've used. So if there's if you have any issues or anything, please contact LearnerWorks in the UK Varsity email, but also refer to Moodle. Moodle is the main source for you to get any sort of resources or anything. Thank you for today's session, and I will see you tomorrow for Learning Outcome 2. Thank you.